Today is May 15, 2025. You're listening to Infection Navigator, your source for global insights into emerging health threats. Across the world, a shifting constellation of viral outbreaks, resurging epidemics, and policy transformations are shaping how humanity confronts disease in real time. In this briefing, we explore where we stand, how we got here, and what the path forward looks like. In the United States and parts of Western Europe, the reappearance of measles, once considered a disease of the past, is prompting serious concern. Over the last quarter, confirmed cases have emerged in dozens of U.S. states, with clusters surfacing in California, Texas, and New York. The situation in Australia mirrors this trend, where public health alerts were issued following exposures at Melbourne's major transportation hubs and educational institutions. These outbreaks are not occurring in a vacuum. Measles was declared eliminated in the U.S. in the year 2000. The fact that we're seeing widespread cases in 2025 reflects the steep decline in immunization uptake in certain communities. Misinformation, distrust in institutions, and the ripple effects of the COVID-19 vaccine discourse have left gaps in herd immunity. When immunization rates drop below 95%, measles, a highly contagious airborne virus, finds its opportunity. This return echoes the challenges of the 1989 to 1991 U.S. outbreak, when more than 55,000 cases occurred. History, once again, is testing our memory. Meanwhile, H5N1 avian influenza is transitioning from a largely agricultural threat to a growing human concern. While avian flu has circulated in bird populations for years, the virus has begun crossing into mammals with greater frequency. This spring, several dairy workers in the United States tested positive following exposure to infected cattle, a notable shift from past patterns. The specter of zoonotic spillover is no longer hypothetical. In regions of Southeast Asia and Central America, H5N1's spread among wild birds and poultry has also intensified. This isn't the first time we've faced avian flu risks. The 2005 H5N1 outbreak in Asia was largely contained through mass culling and biosecurity. However, today's interconnected world, combined with more frequent viral mutations, raises the stakes. The current strain shows evidence of adapting to new hosts. While sustained human-to-human transmission has not been observed, the possibility demands vigilance. The scientific community is working rapidly to develop updated vaccines and antivirals, while public health authorities weigh the risks of culling versus containment. In tropical and subtropical regions, diseases carried by mosquitoes are on the rise. Chikungunya, once a relatively obscure viral illness, has now infected tens of thousands in La Réunion. Dengue fever is again surging in Fiji and northern parts of South America, with thousands of confirmed cases reported just since the start of 2025. Both viruses are transmitted by Aedes mosquitoes, which flourish in warm, urban environments with poor drainage and standing water. Climate change has undeniably expanded the reach of these insects. Warmer winters and longer summers have increased mosquito populations in places once considered safe. The proliferation of international travel adds another variable to the equation. Public health officials are focusing on vector control, education campaigns, and the acceleration of vaccine trials, particularly for dengue, where a limited but imperfect vaccine already exists. Across the Indian subcontinent, the Nipah virus has re-emerged in the southern state of Kerala, raising questions not just about containment, but about knowledge gaps. While bats are recognized as the primary reservoir for the virus, the exact mechanism by which it enters human populations in this case remains unclear. In prior outbreaks in Bangladesh, transmission was linked to the consumption of raw date palm sap contaminated by bat saliva or urine. Today, no such vector has been confirmed in Kerala. This ambiguity is dangerous. Without a clear transmission route, health authorities struggle to implement targeted interventions. Nipah carries a high fatality rate and can be transmitted between humans, particularly in close quarters. The need for coordinated ecological research, zoonotic surveillance, and community education has never been more urgent. Ironically, Kerala also houses the Institute of Advanced Virology, a facility specifically designed to handle such outbreaks with Level 3 and Level 4 containment capabilities. Despite this, samples from recent Nipah cases were sent to labs hundreds of kilometers away, resulting in delayed diagnostics. This highlights an often overlooked issue in global health infrastructure: the underutilization of local resources due to bureaucratic hurdles, lack of funding, or institutional distrust. In the United States, developments in vaccine oversight are drawing both curiosity and controversy. The appointment of Dr. Vinay Prasad as the new director of the FDA's Center for Biologics Evaluation and Research marks a philosophical shift in the agency's leadership. Known for his sharp critiques of pharmaceutical policy and overreach, Dr. Prasad advocates for more rigorous vaccine trials, full transparency, and a higher bar for emergency authorizations. While many praise this move as a return to scientific rigor, others caution that it could slow the availability of crucial immunizations during outbreaks. Balancing risk with responsiveness is a perennial challenge. In a post-COVID world, where public skepticism still lingers, even well-intentioned delays could have serious consequences for public trust. At the global level, the World Health Organization continues to monitor potential pandemic candidates. The recent uptick in zoonotic signals, animal viruses showing signs of adapting to humans, includes pathogens not just from bats and birds, but rodents and even marine mammals. Deforestation, habitat fragmentation, and aggressive urban expansion continue to increase the frequency of human-animal encounters. The barrier that once separated wildlife pathogens from human populations is rapidly eroding. What we're seeing now is not a series of isolated incidents, but rather a mosaic of vulnerability. Each viral event, from a measles outbreak in a major U.S. city to a bat-transmitted illness in rural India, is connected by broader themes of ecological disruption, misinformation, and institutional strain. These are not just medical problems. They are societal, cultural, and infrastructural reflections of our preparedness, or lack thereof. The path forward is clear, even if the terrain is not. We need stronger local labs and smarter global cooperation. We need science education that outpaces conspiracy theories, and supply chains that don't crumble in crises. Above all, we need to listen to experts, invest in prevention, and respect the invisible boundaries between human civilization and the natural world. Thank you for joining Infection Navigator. Continue to stay informed, because in the world of infectious diseases, awareness is not just power, it is protection. Stay safe, stay thoughtful, and we'll meet again in our next global health briefing.